So first, it's important to remind ourselves that, seizure clusters are common among people with epilepsy, and they can severely impact their daily life and overall prognosis of epilepsy. And despite available new nasal rescue treatments, there's still a gap in their optimal use. So our focus on this study was on one type of rescue medication, which is Midazolam nasal spray, which is approved for treating seizure clusters in the United States for those 12 years and older. So there was a randomized phase 3 study called the RTFBF that confirmed its safety and efficacy. And this study was then followed by an open label extension trial called the RTFBF2, which enrolled patients that finished the RTFBF1. And again, this study confirmed that, again, the safety and efficacy of this compound over repeated use. So what we wanted to look at was how quickly patients regain full functionality after using this rescue medication. And also we wanted to examine if this recovery time would remain constant with repeated use. So our team conducted a thorough analysis of the open label extension trial, which is what I mentioned, the RTFBF2 study, focusing on 161 patients who used midazolam nasal spray across nearly 2,000 seizure cluster episodes. And the main findings of the study, are quite positive. We observed that the majority of patients, 97% of those who took one dose and 94% of those who took two doses, returned to full baseline functionality within a single day of administration. And that was assessed by the caregivers. They had to assess whether they're back to the way they were before they had the seizure, back to their normal selves. And even more encouraging are two observations that we found. One is that when you look at the median time to achieve this full functionality after using the medication was just over an hour. And this was regardless of whether they use one dose or two doses. So, it seems based on the observation that the total dose of midazolam didn't matter in terms of that time to be back to themselves. And the second observation was that this response time did not wane with repeated use. And so, another thing that was, a bit surprising to find out was that we noted that as patients experience more seizure cluster episodes and using the medication more often, the time to return to full baseline functionality was shorter. We don't have an answer in this study of why that happened, but we hypothesize that this may reflect that an increase in ease and efficiency in use as the caregivers, the patient, learn how to use this rescue medication, how to use it better over time.